Welcome to Friends with Fertility, the podcast where we dive deep into the world of fertility, reproductive health, and all the emotional journeys that are in between. I'm your host, Elizabeth King, a fertility expert dedicated to providing you with the knowledge, support, and inspiration you need on your path to parenthood. Whether you're just starting out, exploring your options, or looking for solidarity and advice, we are here for you. Let's embark on this journey together and turn uncertainty into empowerment and make friends with fertility. Let's get started. Hey everyone, welcome back to Friends with Fertility. Today we have Natalie Richeimer. Am I saying that correctly?
Richeimer, very close.
Richeimer. Okay. She is a genetic counselor, and we've had a genetic counselor on before, and I think that this is such an important topic to talk about, and it's becoming more and more normalized, I guess, in the society that we live in today for several reasons, and it's really it's amazing that we have the technology that we do now in order to have this be a thing. I know that there's people that lie on both sides of the fence on genetic testing, et cetera, anyway. So we'll dive into that as well. But tell us a little bit about how you got into genetic counseling and what lane of genetic counseling you work in.
Such a great question. So I was totally not a genetic counselor for a long time. In a whole other career, I was a high school STEM teacher, and my goal in life was to really empower and educate women to go into STEM. And what had happened was through that process and journey, I wanted to have kids of my own and found myself in the just odyssey of infertility, like so many others, and found myself going through IVF to have my two beautiful boys, and really, getting a little more intimate with the world of genetics because of that. And was like, okay, like this is where I need to be. I need to be a genetic counselor. So, um, while I was pregnant with my second child, I applied to grad school, which was kind of crazy. I had him as a newborn and did my grad school training, um, and really fell into this to really empower people who wanted to have children of their own with really great information, because I felt like that was something that was really needed on my journey. And that is kind of how I became a genetic counselor. So reproductive genetic counseling has always been my specialty, my passion. And after a long time in the clinic, I felt like I wanted to do something a little different. And I joined a nonprofit called JScreen, to really work on community education and outreach. So I'm not just limited to the people who end up at my clinic and just the patients I see, but really just empowering people with information in different formats, kind of like through this podcast, to learn how that they can advocate for themselves and how genetic testing may be really helpful in their journey.
I love hearing people's story of their own because it inevitably ties back to something personal, which I personally love because I feel like those of us that are in the lanes of doing the work and serving people from that regard are usually coming there because of our own journey. So, as a mom yourself, how has parenthood shaped your perspective on the work you do now?
I think parenthood and having gone through the IVF process. So when I see patients and they're telling me, listen, I'm down to one embryo and I can't afford to do another round, I get that. I've been there. I know what it's like to really struggle to build your family. I also know what it's like, just like the anxiety of a pregnancy, in any way, shape, or form. And I think that's been really helpful for me to empathize with patients. I always say, like, when I did work in the clinic, I shouldn't say this, but I did it. I checked results on weekends because I would want someone to do that for me, right? Like, people's anxiety don't shut off at Friday at 5, right? So I wanted that type of care, and I tried to provide that care to my patients. As a parent, um, I'm happy I did grad school before I had them, because you learn all the things that can go wrong in genetics, and that can kind of make for an anxious pregnancy. So that's been helpful, but like also realizing, that what you're seeing with that patient for that 45 minutes, an hour, is really a tiny slice of who they are in their life. And getting that, I don't go home with their problems at the end of the day. And so really like allowing me to not have any judgments on anyone, and to really leave it as a safe space of like, yourself, who you come home to, and support their decisions because they do know what's best for them.
Absolutely. And you're originally from Toronto, I saw in your bio, and now live in LA, so not too far from me. How has your experience in these cities influenced your approach to reproductive health education? And I know just from my work with working with different people around the world, even Canada, to hear there are differences from the fertility perspective with our governments, et cetera. But what have you noticed having been living in both places?
So again, I grew up with socialized medicine. I know everyone feels differently, but I really didn't have a bad experience. And being able to go to the doctor of my choosing for free was kind of nice. And I do feel really strongly and passionately about making assisted reproductive, care in this country more affordable, because it's unaffordable the way it is, and that limits so many of us. Um, I also see the beauty in like a paid system. So I'm kind of spoiled in that, now I don't have wait times. I don't have to beg my GP to refer me to someone. Um, so, pros and cons in both. And I think there's a lot of learning to be said. I did part of my training in England. So I got to see like a whole third system, which was really interesting. And I would say the good care is good care. But I do feel really passionately, especially where we're at right now in this country, of like, it sounds like we are going to hopefully provide coverage for more people.
Right.
I am hopeful, and I'm like I said,
Yeah, me too.
I'm hoping we end up in a great place and helping more people have families.
Yes, for sure. So let's break down genetic counseling 101. What exactly does a genetic counselor do, especially in the context of fertility, for those that are listening that may not really know?
So I always say two pieces to what a genetic counselor is. A genetic counselor is somebody who has a specialized training in genetics. We have a lot of clinical training. We know a heck of a lot about genetics. That is what we're doing. We also have a counseling background. We know that anything to do with healthcare is incredibly emotional. And we have a psychosocial training for that to help provide empathy to our patients, provide guidance to our patients, especially with genetics. Things can be very complicated, making sure we're providing that emotional support as well. And we're not doctors. We never will be. That's not who we are. But we work with doctors as part of a team. So in a fertility setting, I may be working with your REI or your nurse to really coordinate care with regards to genetics, whether that's genetic testing or further evaluations. Um, and recommending certain things or certain specialties that you may go into as a result of genetic testing. So, I know we want to talk a little bit about cancer, but we may recommend, increased cancer screening or certain types of testing on the embryo that we might not have without genetics. So we really provide that guidance, that specialized care.
And what's the difference between carrier screening and diagnostic genetic testing?
Such a good question. And I'm going to peel back a layer before we talk about that. So, carrier screening, just for those who don't know what that is typically going to be a blood saliva test that's going to look at certain genes or instructions in the body. Most of the time, they're looking at recessive genes, so genes where people typically have two copies, to see if one out of the two of them is working or non working. Somebody who's born with one out of their two copies working is called a carrier. And the tricky thing with carriers is typically they don't show any signs or symptoms of the diseases they carry. It's incredibly common. Most people carry between 1 and 5 conditions. And the way they often find out is by having a child with disease. So the idea of carrier screening is to screen you, to check for whether you're a carrier prior to having kids and prior to that conception journey. It's a huge part of, and it should be a huge part of anyone's workup for IVF. because it is really helpful in informing treatment.
I actually think it should be a workup for anybody trying to conceive
Oh,
based on
I'm
the
with you.
situations that
I
I have seen.
100% agree, Elizabeth. I think anyone who is thinking about having babies at some point in the future should get it done, because information earlier just gives you more options. But
Right.
that is a different conversation for a different
Correct.
time.
Right.
Um,
I couldn't help myself.
you know what? We speak the same language. I totally agree. Um, but with regards to what does it mean screening versus diagnostic testing? So with carrier screening, we're looking at different genes, and screening can be done by different kind of checking methods or like lab methods. With diagnostic testing, we're looking to diagnose someone with something. So we're looking to say, like, this person has the following symptoms. Um, we are diagnosing them with a very specific disorder. And the technology behind that is a little different. The way we do carrier screening is a little different than the way we do diagnostic testing. They're both excellent genetic tests, but it really comes down to um, in simplicity, like why are we doing this testing? Like, are we doing this testing because we think someone has a specific condition, or are we doing this testing to give us an overall risk like assessment for the patient that we're seeing?
So we kind of gave ourselves an entry point to my next question is when should people decide that they're going to be doing this or consider doing this? I think based on my experience, it's one way, but I'd love to hear your perspective on this from couples of is it preconception, during pregnancy, or after a miscarriage, et cetera, or
The
after a
best
diagnosis of a child.
Yeah, I mean, the way it comes about for most people, to be honest, in this country is during pregnancy, and it's during, I would say, second trimester, which is tricky because you're already inside a pregnancy, and we know reproductive laws in this country are different state by state. Um, Leaves you with less options. That's how it's done, in my opinion. And again, it's mine. No one has to agree with me, but I feel similarly to you. I think this should be done preconception because it gives you the most options, right? If you and your partner are, or the person you want to have a child with, or the donor you're thinking about using, are both carriers for something, that will change the options that are available to you, and you'll have more time to think about them. Whenever I dealt with patients in the clinic who found out, like 15 weeks pregnant, that they were a carrier, we had to scramble to get the dad tested. Um, get dad tested. That's another 3 weeks. Now we're at 18 weeks. Now we want to test the fetus. That's another 3 weeks. Now we're at 21 weeks. And if it's positive, like, what do we do now? You know,
Oh
you're
yeah,
at a
so traumatic.
so traumatic, and you're really on a time crunch. And like, I always used to say this to the patients. So like, can we pay more money to make this faster? And I'm like, I wish, but I can't get you accurate results with, like, no time. Like, it takes the lab time to analyze. We want to make sure we're getting you real results. So it's tricky. I would say anybody who's thinking about having kiddos, like, do the testing as early as possible. You want to do it at 25, you're not having kids for another 15 years, great. And then you'll update it if you need to, but at least you've done that baseline test to kind of keep in mind for your reproductive journey. I would say for women, there's specific types of genes where being a carrier may not impact their health immediately, but it may impact the fertility. So, being a Fragile X carrier may put you at risk for primary ovarian insufficiency, so premature ovarian failure. And so, having that information earlier may cause you to want to freeze your eggs a little earlier if you don't have a person in your life, or go through IVF earlier. So, the information is really, really helpful to have, I would say, sooner than later.
Right. And surprisingly to me, I feel like genetic testing is not necessarily the first thing that people go to when they've had multiple losses and things, unless there is something overtly obvious that a doctor might say, you want to check this out. From my experience in the several years and working with thousands of people, I would say, again, my opinion, like you're saying, is that go and ask to have this done based on either saying that you have a family history. You know, if your family history has had losses or miscarriages or stillbirths or something, and it's kind of been swept under the rug, those could be, indications that something may be wrong genetically. It may not be, but I always say it's better to have the information and to check that box and know. There's a lot of geographical situations that come up. So, based on your heritage, your nationality, your background, that there's certain genetic situations that come up more likely for, light skinned people from England in their genetic line, so to speak, and or certain areas of the world. So you know that ahead of time to say, okay, if I know that I might be more likely to have X or Y. I think it's always really helpful to know if your family is a carrier of something. And therefore, when you do meet somebody or you do go into wanting to have a baby, like, hey, you might want to get checked because I know I'm a carrier for this. And if he's also a carrier for this, we're going to have a big issue potentially with our child. And like Natalie said, a lot of it is, people don't even realize that they are carriers. I've seen so many people that they have to get tested. Their parents, which are the grandparents of the babies, have to get tested, et cetera, just to come to find out that they have this in their family line, and only to find out that it's super common in their nationality. So I just want to make that statement because it's not uncommon. It's just uncommon for us to have the conversation about it. And now that we have the technology to do that, it just makes the path so much easier. And when you're educated about things, you can do better. So I think that's an important thing to talk about that then also now leads us into cancer and genetic testing and all of that. So tell us what you know about cancer specifically in relation to fertility.
So, different layers, I would say, to the cancer. I know I'm layering everything up, but there are people who come to us because they themselves have cancer, right? And so that's going to change their timeline a little bit. Some people will get cancer super young before they've had kids, or maybe they've had kids and they haven't completed their families. They may need to do, what we say for fertility preservation, to make sure that they can, preserve over eggs or sperm for those future children. That's one thing. We also have people what we call previvors, so people who haven't had cancer yet, but we know have a genetic predisposition to cancer, and may be doing this as a proactive way, again, to prevent themselves from getting cancer. So something that is very famous, made famous by Angelina Jolie herself, is the BRCA1, BRCA2 genes, and people who have a non-working copy of that, we know them to be at higher risk or have a higher chance of certain types of cancers, one of which is ovarian cancer. And we have great screening for breast screening to prevent people from getting breast cancer. Our screening for ovarian cancer isn't great, which means that at this point in time, again, hopefully it will change, the best way to prevent someone from getting ovarian cancer is unfortunately removing their ovaries and tubes, which would put someone in automatic menopause. And so for those individuals, fertility wise, they may want to, pursue egg freezing or embryo creation a little earlier in the game. We also have the other piece of if someone did have cancer, or like we said, as a previvor, hasn't had cancer yet, has that predisposition, and they have a specific genetic change or mutation that they carry, they can actually do IVF to select for embryos who don't have that change. And they can test the embryos and they can have that stock with them. For people that I've dealt with in the fertility space, both personally and as patients, there's something really powerful and empowering about saying that this stops with me, and that I can, make sure that my children aren't at risk for the same, health experience that I've had that has, for some people been really traumatic, and really, empowering. So that is kind of how it can be used um, in a cancer setting, both, like I said, for people who have cancer or people who are at higher risk for cancer.
So, what I'm hearing you say in relation to cancer, it doesn't necessarily matter whether the cancer you have is genetic or not, right? So, one area would be it's you're a genetic carrier for it, like the BRCA gene. The other would be maybe you are diagnosed with a cancer that they say it's not hereditary, it's not genetic, but you still need to preserve because it's going to affect your fertility in some way. So, I just want to make that super clear because genetic testing can still be done, even if you're told it's okay, it's not genetic, you still would want to preserve your fertility. So that's a great
100%.
thing that it's not genetic, but at the same time, you still want to figure this out sooner rather than later if you have a diagnosis.
Yeah,
So, two separate things for people to understand. Do
absolutely.
you see any cultural or generational differences with genetic testing and how people kind of view it and their approach to it?
100%. First of all, yes. Different communities feel differently. With regards to, I say like generationally, like our parents didn't have the same abilities to
Right.
do genetic testing like we did. It was super expensive. It was super under lock and key. We have, like my nonprofit that I work for, anybody can self-order hereditary cancer testing. That would have been unheard of 10 years ago. Like to be able to take that initiative for yourself, what? Like, so because of that, I feel like our parents' generation may not be familiar. Um, and even if they are, there may be this kind of feeling of like, why is that? Like, why are you doing that? You're just going to stress yourself out, right? Like,
Right.
don't go
I
for the
feel like
fertility.
often they're like, "We didn't do that. We didn't do all those things." I
And
hear
you
that
turned
even
out
from
totally
parenting.
fine.
Yeah, exactly.
Yeah, no, 100%. And like they just may not understand like why would you do that? That just will make you upset and anxious, right? So I think there's definitely that generational difference. And again, I'm stereotyping a little, but it's something I've experienced a lot. And I have grandmas who are coming with me to clinic and they're like, what is this? We don't want to do this. Um, I would say culturally, like again, for some cultures, there are stigma associated with being a genetic carrier, and whether that's something
From
you
which
agree with.
perspective, as far as like not wanting to admit that it's something that is part of their culture, or what give us an example of that?
I'll give you a great example. Like, we don't want to find out we're genetic carriers because that means there's something quote unquote wrong with us or abnormal with us. And I'm saying that in quotation marks, right? Um, why would you do that? We don't want to mark our family. And different cultures feel differently about that. Um, I think there's also like just denial from certain people, like, oh no, there's nothing wrong with my family. We're perfect. We wouldn't need to do a genetic test where we know, you know, most people are carriers for something, right? And there's nothing abnormal about being a carrier. It's in fact very normal. It's very common. Um, so there are things like that, I would say, that definitely play into different cultures. I would say, like, with religion, it's always tricky because some people feel like, I want to, and again, I am being very general here and I'm not talking about any specific religion, but like some religious people will be like, I want to trust in God and God will figure it out for me, right? Like, I don't want to do this type of intervention, which again, I totally respect. I just, as a genetic counselor, want to give you that information so that you know what you're refusing before you refuse it. Like, let's talk,
Right.
Um, I think that's really important. And again, I've dealt with a lot of people. I'm in LA, so a lot of different ethnicities and religions and a lot of diversity here. And I think meet with a genetic counselor, talk about what your concerns are, and tell me, like, if there's a religious component to this that I'm not understanding, that's totally okay. Let's talk about it.
Right.
If there's a cultural situation, let's talk about it. But my job will always be to give you information, never to force you to do testing. Like, that's not how I roll. That's not how any genetic counselor rolls. But I want you to have all the facts so that you can politely decline testing. I'm totally fine with that.
So you mentioned that at JScreen you can order testing or do testing through them. Is it like a baseline level of tests? How many things does it screen for? How do you know that you don't need to go deeper than that?
So I would say like this, it baseline is always a very relative thing, right? For some people, baseline is 3 genes. For some people, baseline is 700 genes. So I don't like to answer
Right.
that. But what I would say is our testing is pan-ethnic. So meaning whether you're European or African American or Asian, this testing is appropriate for anyone based on any ethnicity. The hereditary cancer testing looks at 48 genes associated with 11 different types of hereditary cancer. So that's a really good, I would say, comprehensive test. Now, there are people who are going to have very specific things in their family history. If that's you, you're like, I've got a really strong family history of, I don't know, pancreatic cancer, and we have this rare mutation that's only screened for by one lab in the country. By all means, go get that very specific test. But
Right.
if you have like a general family history of cancer, or you just want to know your risk for cancer, I think it's a great test. Same with our carrier screening, it's over 200 genes. Um, it's great, but if you have this really complex history of like multiple stillbirths or multiple late term losses, like this is something you should be taking to see a genetic counselor and having pre-test counseling and seeing if there's something more specialized for you. So I would say, like, if there's a family history and it's very specific, meet with a genetic counselor, see if there's something specialty, because we know certain people are going to need special types of testing. But as a great test to order for yourself, it will suit the needs of most people. But in genetics, we're dealing with a lot of exceptions. So I would say, like, get that family history from yourself and from your relatives, and kind of think about, hey, are there kind of some strange things or things that I should have like assessed as a whole? Maybe I need something more specialized.
Right. It's so hard too because it's not that long ago, going back with like great grandparents, at least from my age, where like infant death and young childhood death of things was pretty common. So it's hard to know, like, I was told one of my great grandmother's children died of leukemia. Was it really leukemia? Did they really know in like the
Yeah.
early 1900s that that's what it was? You know what I mean? It's funky. So I feel like now, at this time that we live in the world, we do have all the technology for you to be the baseline of your family going forward, right? Like, we may not be super clear about our ancestors to date because there was no true information about that. There was no technology to say, oh, yes, you had XYZ. And I don't even know, like I said, do I really believe that they could tell at that point in the late 1800s, early 1900s, that it was leukemia or this or that? So, if nothing else, educate yourself for your future family that you're bringing in to be able to say, hey guys, this is what we have going on in our family. We just want you to have the heads up of what could potentially be coming down the pipe for you or your kids or whatever it may be. I just feel like that's really helpful for people to know. So, speaking of young people, how do you talk to these? I know you go into high school, so tell us about that. And how do you talk to these young kids about such a complex topic?
So I always talk with high schoolers, I would say, at their level. Most high schoolers are not thinking about having babies, most of the ones that I've met. They are thinking about going to college, having a good time. So this is more of a hypothetical conversation. But this is really, I do it as a part of like a more of a reproductive kind of thoughts of like empowering yourself with health. Again, like women's health has always been something that's been a passion of mine. And like, teaching people that like this is one thing that you're going to advocate for, but you're also going to advocate for yourself if like you feel like your periods are abnormal. Like, let's talk about that, let's do that. So it's really in the sense of advocacy and how to empower yourself with knowledge, and understanding. And this is something I feel like I didn't get in high school. Like, when you are in the big bad world of medicine, you got to be your own advocate, because no one else is doing that for you, unless of course you have an amazing fertility coach like you. But listen, on your own, if you're not going to advocate for things, and I love how you said that before, like the doctors aren't necessarily suggesting for losses to get testing, you need to be able to speak up for yourself. And so this is much more about health education and empowerment, of individuals, because at the end of the day, knowing things and being able to have intelligent conversations with your doctor completely shifts the mood, in my opinion. It completely shifts the narrative. um, and getting your questions answered in a way that makes sense for you. So we do a lot of that. And then just again, like really driving home this message or this mission that I have of like preconception testing is huge. I am an IVF mom of two, and my favorite thing to do is show. I have a picture of me and my husband in Australia on year 3 of our infertility odyssey, and it's super glam. It's like by the opera house, and I always say to the kids, like, what do you see in this picture? And they're like, oh, you look so cool. And your husband looks so cool. And you're in Australia. How cool. And I'm like, I want you to look at this and understand that I am the most miserable person in this picture, like the most unhappy I've ever been in my whole life. Pictures lie to you, like, experiences, like that you may think that you understand because social media tells you someone is happy is not true. So it's something I really drive home, and that like all of us have issues, but also understanding that like fertility issues are real. And like I talk about my experience and being in my early 20s and spending my whole 20s, like I joke, I spent my 20s not at the club, but like trying to get pregnant. So really driving that home as well, and like understanding that life doesn't always send you on the journey that you think that you're supposed to be on, and how to accept that. So it's lots of life lessons, hopefully not just genetics. And I've gotten really great feedback.
That's so fun. I was having a conversation with my youngest who just turned 5 and my husband who was dropping him off this morning. So I called them in the car, and something about this day, I think that the weather and whatever reminded me of when I was trying to get pregnant with him. And so I said to him, Branson, you are so loved and you are so wanted, and mommy and daddy wanted you so bad, because it just reminded me of that time, Natalie, like of, this time of year. I got pregnant with him in May. So I was devastated and heartbroken from a loss that I had just had, and, trying to figure out, were we doing IUI or IVF or what was happening? And, it's all the things, but it's funny how like just the weather of the day can bring you back to that moment of, gosh, I'm so grateful now that I have you, and we're so happy that you're here,
Yeah.
which is really cool when you're talking to the little ones that truly were intentional of being here. Not that the ones that aren't are any different, of course. We're grateful for all of them, but it is definitely different when you have so much intention and prayer and all the things going into creating this little one to come. So,
Yeah.
how do you balance delivering potentially difficult information while empowering your patients with knowledge?
It's hard, and I will say like my job is not always to give good news. In fact, a lot of the times I'm giving really, really hard news. I think it's really, first of all, being honest. Like, I really don't like doctors who tell the patients one thing, send them my way, and they're like, Natalie, you break the news. And I'm like, please don't do that. Because I don't like being the bad guy ever. And I don't think I am the bad guy. I think like being honest with you is always better. It may be not be what you want to hear, but it's better. So I think like for me, it's just being honest about the situation. It's also being sensitive and understanding. Like for me personally, hearing hard news, I may not be able to process that and then understand everything in one session. And being able to say, like, especially if I'm seeing my patient is struggling, they're breaking down, like they can't, nothing is going in, saying, hey, let's reschedule to talk about what this means in a week. Let's give you some time to process so that now you can ask those great questions. So splitting up is, I think, really, really important, and like gauging what the patient needs from me at this time. They need to cry with me, let's cry. If we need hard facts, because some of my people, they want statistics and they want their facts and they want to do their own like let's do it, but really listening to what the patient needs, not assuming what I would need because I'm not the patient here. um, and I think that that's key. And at the end of the day, like my goal always is, like you're saying, like I may not give you what you want, I may not give you the right answer that you wanted, or I may not even have the answer, but I'm going to give you the best information I can so that when you leave my office, you are always empowered with more than what you came in with.
Mhm. That's awesome. It's such a difficult time. And not only is getting news like that for yourself as an adult hard to hear, but when you know that it's affecting your potential future children and or maybe your pregnancy that you have right now, it's I feel like it's even more of a blow, because you're not just dealing with yourself, you're dealing with your future, etc. So it's multi-layered, I imagine.
Yeah.
What emerging genetic technologies or trends do you see that are coming our way in the next 5 to 10 years? What are you excited about?
I mean, excited and nervous, but our testing is getting cheaper, which is exciting because That means we're going to have more powerful testing that's available, that's better. I have a lot of genetics friends, as you can imagine, and they're saying whole genome sequencing, which is looking at every gene in our body plus other things around the gene. They think everyone's going to be able to get that in about 5 to 10 years, standard. It won't be special order, which is so exciting because we'll be able to get a lot of health information, a lot of it which can be preventative, like cancer and things related to like diabetes and heart disease and things like that, which is so exciting. On the flip side, kind of terrifying, because not everybody gets good genetic counseling, gets good genetic information before, and may not understand what they're signing up for. So I kind of always get nervous with consent. I'm a big believer in informed consent, and don't want once you have the testing done, you can't take it back. That's what I always tell people. I can't take the information back once I open the Pandora's box. So I do think that that is something that we're going to happen. I think also our IVF is going to get way better. The genetic testing, what we're able to do with that, and hopefully like screen embryos, not just for single diseases at a time, but like bigger, better. Really excited for that too.
Yeah, me too. What's one thing you wish that everyone knew before starting their fertility journey?
What? Don't take advice from people. Like, just don't. No, outside of your care team, do not take advice from people. I felt this way when I had my first child, where like everyone was telling me all the horrible things that were going to go wrong with having my baby. And like at the end of the day, some bad things did happen. But you know what? It was my journey and my experience, and having that anxiety and those people, in your head who, we all know those people who mean well and are like, I had this cousin in Arkansas. She did this and her IVF worked. And you're like, but I'm not your cousin in Arkansas. And don't, don't take advice from people who are not part of your care team. With love, you're going to say like, I really appreciate that you care for me. Like, I don't want to talk about this with you. You can support me in other ways. So that's
Love
something,
that.
yeah, something I've really
Great.
passionate.
And how can people access JScreen and what should they expect from the process?
Great question. You can go ahead and log on to jscreen.org 24 hours a day, 7 days a week. You can order either hereditary cancer or reproductive carrier screening straight to your home. Saliva kit comes to you. You can order both, which a lot of people in the fertility space like to do. Spit and tube, super simple. Get your results in 2 to 3 weeks. And then you meet with a genetic counselor, someone just like me, who goes over those results, explains how they're going to be used. What's nice is that we do take insurance. So if you have insurance, I always recommend bill your insurance, see what they'll pay for. If the out of pocket cost is too high, you can always cancel. But typically the max out of pocket is 298 cash pay. So if that your insurance is not great, some people will just elect to do that. And reproductive carrier screening is often covered. So I would highly recommend, if you're of reproductive age, definitely something to think about. And yeah, it's a great service. And like we said, we're a national nonprofit, so our our thoughts are to get people tested and to do it comfortably and easily.
And where can our listeners connect with you and follow your work?
You can go ahead and take a look at me. I'm on the Get J Screened account. You'll see me a lot. I do a lot of really cool like Instagram lives, and Elizabeth and I connected there. So I do a lot of that, and that's kind of the best way to see me and to reach out to us. If you have questions, DM us on Instagram. We're always looking at the DMs and hopefully helping you guys get the help you need.
Thank you so much for being here and doing the work you do. I truly believe that it's going to change the world that we live in, the more that people are educated about this and know that genetic testing is an option for things. I mean, there's so many stories. You and I'm sure, could talk for hours about these things. And just more education gives you more power in all situations in your life. So please check out JScreen, see what tests you feel comfortable with taking, if any, but at least just take a look and educate yourself so you can make an educated decision of, like Natalie said, I'm opting out to know this information, or maybe this is something that I should know. And I'm assuming that the partners can also test through JScreen.
Yep. And the most beautiful part of that is the partners can test. We partner with a company called DNA Visit, so you don't have to have a referring provider to sign off on the testing. DNA Visit will do that. So it really just makes it super simple. And yeah, like, I'm so happy to be here, Elizabeth. The work you do is incredible. And thank you for supporting so many women like myself and people around the world who are trying to build their families.
Well, thank you for taking the time today to help educate everyone out there around genetic counseling and what it means to them. Thank you for joining us on this episode of Friends with Fertility. We hope that you found the stories, insights, and tips as inspiring and informative as we did. Remember, you are not alone on this journey. Your friends with fertility are here for you. If you've enjoyed today's episode, please subscribe, rate, and leave a review on your favorite podcast platform. And don't forget to follow us on social media for updates and more fertility resources. Until next time, stay hopeful and keep believing in your journey, and know that we are sending you lots of love.